My name is Sarah Hannigan. I'm practice nurse at Paddington Doctors. My role here is slightly different to other practices. I've been fortunate to be here since the beginning. So I welcome each patient, and that's my point of opportunity to check off on the data that we've collected through AutoMed. I also routinely do a set of observations so that we have the full picture for the patient. It's obviously a good opportunity as well to get to know the patient and develop that rapport so that when they come back in the future, we already have a bit of a meeting, and it's much easier to then get more information from patient and patient to feel more comfortable. My other roles include general nursing duties, care planning, health assessments, another two great opportunities for data collection and to make sure that we're on top of patient care. We really try hard to be proactive rather than reactive in the practice. So we're looking for things that we could have missed, opportunities such as female patients that come to the practice on their first visit. We'll investigate to see whether or not they've had an up-to-date cervical screen test if they're between the age of 25 and 74. That's a great opportunity for us then to know where we're at and be able to put a recall in if it's current, or encourage the process if it's overdue. These are all things that have been highlighted, particularly to me after a long time in general practice. The importance of the data that we're collecting actually improves the quality of patient care that we can give, because if we know where the gaps are, we know what to fill. But if we're travelling blind, then we're just going by what the patient tells us at the time. We can't really use that tool to be proactive. Also, by screening patients regarding their alcohol, smoking history, it's another opportunity if they are a smoker to then be able to delve into that a bit deeper and to offer tools and assistance in cessation of smoking. If they're diabetic, we can make sure that they've got a care plan, that they're in contact with the correct people such as the podiatrist, the diabetes educator. So it's a great opportunity for us just to get on top of the whole care of the patient in a holistic way. One of the projects that we've undergone is we became aware that we had a very limited number of cervical screen tests being recorded in patient files. In fact, we were running at 6% initially, and that was just because it wasn't something that we had identified initially as one of the data statistics that we needed to input. And I'm proud to say that we have now achieved a score of, we're running approximately 84%. We've been able to do that by really delving into POLA and finding out who did not have a recording in their file. And by identifying those patients, then we're able to check the register first off to make sure that our records are accurate. And if not, then we're able to update our records, which then impacted on POLA. And if indeed they were outstanding, then we have a process then of sending a text message to remind patients they're overdue. If that fails, then we send an email, and then we get on the phone. So it really has been a labour of love, but we've got there eventually, and now it's one of the things that we do at that very first interaction with any female between the age of 25 and 74. It's normally very much appreciated by patients. Often it's something that they've just overlooked, and they're unaware that they're due, so they're very thankful for the fact. And we have indeed had a number of females who have had tests done, and the tests have come back and they have needed further treatment. So that early intervention is just so imperative. I've worked in private practice now for probably 13 years. Previously, all the data management was done by the practice manager and reception staff. So it wasn't something that I was previously exposed to. But for me, it's huge because it really flags and highlights areas that we really need to improve on. It's not just about the data, it's about what the data is showing you and your areas that are maybe weaker than needs be, and areas that we really need to improve on and focus on. I think it's difficult when a practice that's been around for a long time. We've been very fortunate in that we've been started from the beginning. If you're a practice that's got a lot of data cleansing to do, I think one of the most important things therefore would be to find somebody who has a genuine interest in it. Because I think if one person starts to get excited about it and can highlight to the rest of the team the importance of it, then that's the catalyst that you need to get everybody on board. And to also pick a topic that's important to you and something that you're passionate about. By starting off like that, I think it's a little bit addictive. And once you've managed to get the data complete for just one area even, it's very easy then to move on to your next topic and start the data cleansing process. But I think it really is dependent on the personnel involved, and I think that if you choose the right person for the job, then it's going to happen. But if you have somebody who's not interested, it then just becomes a chore. We are currently undergoing a project with our diabetic patients, which is just about to come to an end at the end of this month. And we've really focused on the care that they have been receiving and made sure that they are looking out to do everything they need to be doing to manage their diabetes. So when that comes to an end, we are then going to focus on asthma, particularly over the winter months, just to make sure our patients are having flu vaccinations, they're up to date with their pneumonia, COVID protection if they choose. And another project that we have discussed with PHN is also thinking about bowel screening, and that would be something that I would be very interested in pursuing, but details to be confirmed. When we have an initial encounter with a patient, as well as doing the blood pressure, pulse, weight, height, I also make sure that I'm talking to them about their sleep hygiene and their stress levels and physical activity and nutrition. And by getting those bits of information, we can often delve a little bit deeper into potentially why they're here. They're diabetic because they've put on weight. They're not eating well, they're not sleeping well, they're stressing a lot, all the triggers for chronic disease. So by trying to get that data in the first place, so height, weight, waist circumference, blood pressure, those are often red flags for us to try and identify areas that we can work on to try and improve their general health anyway. So it all ties into each other. The data is just a tool for us to get to know the patient better and get to the grassroots of potentially the cause of their illness.